Intravascular ultrasound and the new imaging modalities such as OCT are extremely useful in guiding the intervention and also for assessment of coronary atherosclerosis. Basically, these are techniques where you look inside the coronary arteries or peripheral arteries where no other technique would enable you to look inside. Uh, what are the common and normal indications for intravascular imaging? You can use intravascular imaging and OCT to evaluate the coronary and peripheral arteries, guiding stent placement, plaque characterization, guiding PCI, stent optimization, and assessment of left main coronary artery disease and guidance in complex cases. There are two types of intravascular systems. One is called mechanical, which produces sharper and more crisp images, and that is more commonly used. And the second one is the electrical system, which is slightly easier to use, but the image is not as clear as the mechanical system. And in this slide, you could see that this is an image from the mechanical system, and that shows very clear demarcation of intima, which is the white layer inside the coronary artery, and then you could see uh, media, which mainly contains the smooth muscle, and that appears black, and then the adventitia, which is outside the media, that is quite bright and echogenic. And here you could see the wire visualization when you actually insert an IVUS probe inside the coronary artery. And this is a picture showing a normal on the left hand side and a disease vessel on the right hand side with fibro calcific plaque. And this is an example of a concentric plaque on the left hand side and a centric plaque, which is mainly on one side of the coronary artery. And this is a soft and fibrous plaque as compared to calcified plaque. And this is a very small amount of calcium with an arc of less than 60. And this is a medium sized calcium, which is close to an arc of over 150 or 180. The next one is heavy calcium. It's also called the napkin ring, where the whole circumferential part of the artery is calcified, as you could see no shadow behind the calcium. So that is the way to recognize immediately that there is calcium in the coronary or peripheral arteries. And this is an example of a fully expanded stents where the stent studs are fully opposed to the wall of the vessel. This is just an example of underexpanded or malopposed stent studs. You could see at 6 o'clock position, the studs are not fully opposed to the vessel wall. And this is an example of thrombus, how it is visible on the IVS, although thrombus is much more easy recognizable on OCT or OFDI. So this is an example of fibrous plaque dissection extending into the uh, intima on the left hand side, and on the right hand side there is fibrofatty plaque dissection extending into the media. There can't be any more clear picture than that, because when they simple way to recognize dissection when there is a break in the intima, or when the break extend into the media, that is a dissection on intravascular ultrasound. And this is just an artifact, and this usually indicates that the catheter is bent. Then you have to use a new catheter. So the second more recent imaging modality is optical coherence tomography, which is called OCT, and also The other type is called OFDI, and it offers more high resolution, which could visualize inside of the coronary artery more effectively. OCT uses light rather than ultrasound like intravascular ultrasound waves to create detailed images of the arterial walls and surrounding structures, including plaque, thrombus, and stent placements. OCT or OFDI also offers superior resolution compared to IVUS, allowing for more precise assessment of plaque composition and stent deployment. And this is uh, an image of a normal coronary anatomy. As you could see on OCT, there is a clear image of the intima, and then you could see slightly darkish media, and then again echogenic bright adventitia, and then you could see the vessel lumen. So this is a slide which shows a normal vessel, and then it shows different plaque morphologies, which includes lipid-rich plaque as labeled, as well as calcium, and on the panel, which is uh, labeled as L, and it demonstrates macrophages, which are cholesterol containing deposition. And this is an example of what the calcium looks like uh, on OCT. And this is a picture of a sphere calcium with an arc of at least more than 300. And this is a image of a white versus red thrombus. The simplest way of recognizing is that white thrombus is on the left hand side, and there is clear lumen visible behind the thrombus. That's why it is called the white thrombus. And on the right hand side, there is thrombus, but it is adherent to the vessel wall. So that is the simplest way of recognizing whether it's a white and or it is red thrombus. And then the OCT demonstration of a normal lumen in panel A, and then B is a dual lumen due to dissection, and C is a dissection flap, which you can very clearly see. And then D is again dual lumen. And now, what is the difference between plaque erosion or plaque rupture? I will show you the OCT images of that. The plaque erosion is usually characterized by thrombus formation on an intact, though potentially thin fibrous cap without evidence of a rupture. In plaque erosion, the intima is usually intact. OCT can identify erosion by absence of ruptured fibrous cap at the culprit region and the presence of thrombus overlying an intact plaque. The plaque rupture involves a break in the fibrous cap, exposing the lipid-rich core to the bloodstream, leading to thrombus formation. So plaque rupture is usually associated with thrombus, whether it's the white or red, uh, visible on the OCT. OCT can also identify plaque rupture by visualizing a disrupted fibrous cap. So this is, you could see on the right hand side, there is no disruption of the intima, and there is some irregularity of the inside of the coronary artery and of the intima, which is plaque erosion. And on the left hand side, there is disruption of the intima with a little bit of thrombus formation, and that is plaque rupture more consistent with ST elevation myocardial infarction. And this is an example of spontaneous coronary artery dissection, where you could see a false lumen, and all the way in these three top images, and also on the longitudinal resolution. And then this is another example of spontaneous coronary artery dissection, where you could see the caliber actually reduces considerably in the distal LAD, and you could see on the OCT that there are true uh, calcified sorry, two patent lumens. And this is an example of fully expanded stent on OCT, where all the stent struts are opposed against the vessel wall with no gap between the stent struts and the arterial wall. And this is just a comparative example of under expanded stent on OCT. The fully expanded stent is on the in panel A, and under expanded stent in the panel B, and then fully expanded stent on IVUS in panel C, and under expanded stent on IVUS is panel D. And this is just a case which was the first ever case done by myself as a live case. This patient had severe Parkinsonism and aneurysmal formation in the distal segment of the left main stem as well as proximal LAD. So this was performed the first ever IVL on a left main stem after wiring the lesion. As you could see, the IVL in action where the balloon is inflated. And now you could see that after doing the IVL, the patient had a single stent inserted, and it looks back to normal. So this is another picture. And this is a picture where the IVL balloon is still being inflated. And this is an example of a case which I did uh, with IVL, where you could see the cracks, and then after the stent insertion on intravascular imaging, the stent looks fully expanded. And this is another case which was balloon uncrossable and severely calcified right coronary artery lesion, and where you could see that it is quite tortuous. And this patient was treated with a guide catheter extension along with laser. And you could see the laser catheter is almost across the lesion. There was no other modality which could have crossed this lesion. And this is just an example of the laser cuts. And this is just an example of the balloon being inflated after treating the artery with laser. And in fact, in this, after the initial balloon, because of the severely calcified artery, IVL was used as well along with laser to have a hybrid approach. And this is the final result of after treatment and intravascular imaging.